Good afternoon, Vancouver. How is everybody? First of all, let me pause to wish all of the mothers in the audience a happy Mother's Day. I am convinced that that is the most important job in the world. Nurse is second, though, so I'm just saying, nursing is second. I bring everyone greetings from Atlanta, Georgia, and I'm grateful to whoever had a hand in making the weather good for me coming from the Deep South. I could not ask for the weather to be better than it has been since I've been here, and so I appreciate all of that. So let me tell, today we're going to be talking about the role of the oncology nurse. Let me make sure. Okay. So who am I? Let's start there briefly. My name is Kim Burney. I have been a nurse for almost 30 years. July will be 30 years that I've been a nurse. Thank you. An oncology nurse my whole career. So I've been taking care of cancer patients from the beginning of my career as a registered nurse. I did attend Tuskegee University, where I obtained my bachelor's degree, and then I obtained my master's from Walden University. So I've been often asked by those that are closest to me, why did you choose oncology? Why did you choose to work with cancer patients? Because the word cancer denotes such a fear in everybody. And as I've gotten older and more spiritual, I know now that oncology chose me. I did not choose it. It chose me. So as a nurse, fresh out of nursing school, everything was tight and perky. Yeah, I remember. My first job was in Los Angeles, California at Cedars-Sinai Medical Center. And they had a new graduate program, and every 3 months, we would rotate to a different area so that we could determine where we wanted to be permanently. Well, my first assignment was on the medical oncology floor. And everything clicked. The stars aligned, I heard harps playing, and I decided to get out of the new graduate program and remain in oncology so that when I moved from Los Angeles back to Georgia, to Atlanta, it was a no-brainer for me to continue in oncology. So 30 years later, here I am, and I still hold that title of an oncology nurse. And I definitely can't imagine having had a different title for my life. So let's talk about the role of the oncology nurse. What are the objectives? Very briefly, I'm going to define oncology nurse, discuss how the role has evolved. I've been doing it for 30 years, so I can talk about back then and then now. I think that qualifies me. What are the major duties? And then we're going to do a summary, okay? So, what is an oncology nurse? Basically, a nurse who specializes in the care of people diagnosed with cancer. That's the official definition of an oncology nurse. That's it in a nutshell. But though that definition is simple and straightforward, caring for cancer patients is complex and ever evolving. Early on, chemotherapy was administered in the inpatient arena. It was not an outpatient phenomenon at all. People were in the hospital. And what nurses did at that time was find themselves managing the myriad of side effects that came with conventional chemotherapy. Nausea, vomiting, low blood counts, hair loss, diarrhea, all of these other things. But advances in the treatment of cancer in terms of the therapeutic options that we now have, the widespread use of computers, I have to say that because when I started, everything was written. We were writing everything that went on with the patient, everything was handwritten. And they had a special degree in deciphering physician language at that time. Though you never got a certificate or anything, but as a nurse, you had to become quite proficient in that. And then also now that electronic health records are kind of mandated. So we've had to keep up. Oncology nurses have had to keep up. We could not stay in that side effect managing role that we had so early on. So oncology nurses are not just registered nurses, but they encompass nurse practitioners, nurse educators, nurse managers, nurse navigators, and even scientists that now participate in clinical trials. So the oncology nurse is not just the person in the hospital with the uniform on, taking care of somebody with that diagnosis. The disease itself and the treatment options and where we have come has dictated that we also change. So let's talk about then. I can remember being a very young nurse, brand out of college, still in my 20s, and taking care of nurses and patients on an inpatient setting. And literally, we would keep them in the hospital for 3 days after their treatment because they were so sick at the stomach that we sedated them. So every 4 hours, I had 3 different medications in my hand, and I would go to the rooms, and I would push one and let it flush through, push the other, and then they'd be ready for discharge because we could then send them home. So that is the then of oncology nursing. That was making sure that you kept your patients alive after they received this harsh treatment. So let's look at now. What does the oncology nurse do? That is what I'm getting ready to go over in a nutshell now. I'm going to talk about how the role has evolved, what oncology nursing looks like today. So let's talk about the functions. The first function of the oncology nurse is to assess. What does assess mean? That means to look at something or somebody or whatever and try to gauge what's going on, okay? The first step is a thorough assessment of an oncology patient. That's not just a physical assessment where nurses, blood pressure, temperature, pulse. No. You have to look at the entire patient in terms of home situation, financial status, employment. What are their support systems? What medications are they on? What are their spiritual beliefs? And anything else about them that can impact their care. We must view patients as biopsychosocial beings. We cannot relegate patients just to whatever their disease is and take care of them effectively. Oncology nurses have to ask a lot of questions on that initial visit. But much more information is gained as we continue to interact with our patients, and that is where relationship is built. And that is where we build the relationship with the patient and the caregiver, and that is the crux of everything that we do, making sure that that relationship is built. When I was in nursing school, one of the first things they told us was do not get attached to your patients. That was one of the first things that they taught us before we got into the clinical arena. Don't get attached to your patients. Well, once I started working with oncology patients, I discovered that to not get close to them would mean that I have not cared for them to the best of my ability. Because the patients, again, are more than their disease. They are, over the years, I have formed attachments with patients, spouses, exes, girlfriends, boyfriends, children, stepchildren, grandchildren, great-grandchildren, aunts, uncles, cousins, pastors, and pets. Because it takes all of that to get patients through the treatment options and everything that we tend to put them through. So that is one thing that I have to refute, that to not get close to patients is just not serving them well. The next function that I will discuss is education. Education, and to me, that it may be the single most important aspect of the role of the oncology nurse. We are there, and I'm going to use the word we there. We are there to ensure that the patients and their caregivers have a full understanding of the diagnosis, the treatment regimen, the schedule, how are they going to get it, what are the side effects, what other medications will they need with it. All of these different things, we're there to make sure that patients understand, because getting it in bits and pieces is the best way. We can give all of this information on a first visit, but patients don't retain it. So when you come on week 2 or visit 2, then I can bring another aspect in until usually by a month, I've got you pretty good and you understand everything that goes on. So educating oncology patients requires exceptional skill, not just in knowledge of the subject matter. We know that. I'm an oncology nurse for 30 years. I know chemotherapy up, down, side to side. That is not what I'm talking about, but being able to educate on every level, because oncology nurses will encounter the rural illiterate farmer. They will encounter the mergers and acquisitions lawyer. who is now looking at everything from a legalistic perspective. And then we will encounter the gynecologist who has some medical knowledge, but they attempt to take care of themselves even though their diagnosis is not a gynecological cancer. And you all think I'm kidding, I'm serious. So we have to know how to educate on all levels and to do so effectively, because if they don't have the information, then they can't, it makes the process much less successful for the patient. Support, big one, another one. We must support oncology patients, and oftentimes this involves listening more than anything else. Listening. Most patients will have confided things in me that they were not able to share with their caregivers, they weren't comfortable sharing with the physicians, but they've shared it with me, and I never took that lightly. Then I've had the patients and caregivers confide certain things in me that they may not have wanted the patient to know that they were thinking or feeling, because heaven forbid if the patient knew how tired they were or how fatigued they were while they were taking care of them. So they would come in and sometimes ask to see me after the patient go to the infusion room, and we go in a room and they cry because they're tired, but they do not want the patient to see that. So I have to be the person there to tell them, get it out, deal with it now, and then go and continue doing what you're doing. So I was even that person that is supporting patients. And then when they need to vent about the child that's not taking care of them the way they think they should after what they've done over their lifetime. It's also important when oncology patients make decisions that they don't think the physician is going to agree with. I've been in that position many times. I want you to tell Dr. So-and-so that I don't want to take chemo anymore. I'm tired, I'm here, and I'm like, well, you were just in there with them. Why didn't you say it? Because I don't want to disappoint them. Okay, so I've had to do that as well, just supporting them. And even the one that was most profound for me was when I had a patient who was hospitalized and their physician was out of town, so the on-call physician, which is one of the partners in the practice, saw them over the weekend. Well, when they came to see me on Monday, they did not want their regular physician anymore because they liked the bedside manner and the personality of the new physician. Okay, so I had to go in and talk to the first physician and say, Ms. Smith does not, she wants Dr. Jones to take care of her now. And that didn't go well, but I took the brunt of it instead of the patient, having to feel that they've disappointed or having the physician kind of lash out. I'm used to doctors lashing out at me. It wasn't a big deal for me. And I know y'all can look at me and tell I can take it, right? Okay. So now the next thing is to advocate for patients. What does that mean? That means that oncology nurses will go to war for patients. I've done it so many times on the phone with insurance companies and everything when they're trying to tell me that looking at a piece of paper, this is what should be going on, and I'm sitting there looking at the patient. I will pull out all the stops as an oncology nurse. I have even asked, if this were your mother, what would you do? I've asked that. I've asked the question when I had a patient who had been working at the same job for over 20 years, same insurance, never ill, and they wanted to kick him out of the hospital. And so I asked her, how many years did y'all reimburse him when he didn't use your money that in his policy? Did you reimburse him at all? No, they didn't. I said, so do not call me again and ask me when is he going to be discharged. When he is medically able to be discharged is when he will be discharged. So when I say that I've been an advocate for patients, I'm not taking that lightly. We have to be able to go to war, and sometimes that is even with physicians, because I've had to do that as well. I've had to go to physicians and say, I know this is what you order or what you believe or blah, 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 but Miss Jones really blah, 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 blah. I've talked to her, da, 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 da. And the key is, though, I make the doctors feel that it's his or her idea when I get through. So that is the skill I developed over the years so that I wouldn't antagonize them. I just go to them kind of humbly, and when I get through, they think that was their idea, but it was really mine. So again, you have to advocate with insurance companies, radiology department, different labs, physicians, other nurses, MAs, family members. I've had to advocate with family members. I have had to have some closed door conversations with some spouses that were mistreating patients. I've had to close the door and say, I take off my badge, I clock out, because now I'm talking to you as a woman to it was a male, a woman to man, not nurse to patient, because this lady's crying and she's trying to take care of you and you're just being mean, and we understand what you're going through, but you can't continue. And he and I became the best of friends after that. So again, advocating for patients is more than just advocating in terms of it's on all levels. Let me just say that. Advocating is on all levels. And now a newer term in oncology is to navigate for patients. Nurses have to navigate. Oncology nurse navigators is a growing field. I was in Boston the first weekend of this month at the Oncology Nurse Navigators Conference, because they have specialized in getting navigators for the oncology population, because that is a specialty in and of itself. And so navigating means that these nurses are out there and they are streamlining the process for the patients. They are saying your radiation, you're going to need to see a radiation doctor, you're going to have to see a surgeon, you're going to need to see a pulmonologist. They are the ones that help to guide and streamline the process, because you want to make sure patients get where they need to go, when they need to get there, and you don't want them any more overwhelmed than they already are at that point. So the oncology nurse navigator has become more and more important in the oncology space. Again, what do oncology nurses do? We assess, we educate, we support, we advocate, and we navigate. And that is just a nutshell, because they gave me a time limit. I could have talked to y'all for about 3 hours on really what oncology nurses do. Keep going? He said keep going. Nurse navigators, I like to call them the master collaborators. The master collaborators, because they have to not only have great relationships with the patients, but all the other disciplines as well, because you got to know, if I need to get Mr. Smith in immediately, I can call Mary, who's the nurse for this doctor, and say, hey, I got Mr. Smith, he's got this extenuating circumstances, I need to get him in. So they are master collaborators. They are also very fierce in terms of their ability to make sure that what patients need get done. And there are now financial navigators. I don't know if you guys knew that here in Canada, and I didn't know it until I got to the conference. They are financial navigators, meaning you have a patient, then they're doing a thorough assessment of their benefits, their financial situation, to determine what is the best course to get this patient what they need for this diagnosis with less cost as possible. So now they are financial navigators, and I thought that was the most wonderful thing I've heard, because guess who did the financial navigating before? The regular oncology nurse. You know, we're on the phone getting treatments approved, on the phone with Medicare, on the phone with the patient foundations. This is in the States now, getting everything we could do to try to get people on their therapy. Transportation, another thing that navigators do, because a lot of, I spoke about the farmer or the rural person who really does not know how to read or write. Well, sometimes it can be taxing depending on their regimen to get from home to the cancer center. They may need to be there for 2 days or whatever, depending. So the navigators also are very well versed in the services available in their particular area, so that we can make sure patients are getting what they need when they need it. So my personal thoughts and observations here, and this is also part of the conclusion here, because again, oncology nurses do so much that for me to condense it down into this few minutes, I think I did a pretty good job, but I really could have talked for another 2 hours. So though the role of the oncology nurse has evolved, and it had to because everything else has evolved, the foundation has remained constant. The foundation of the oncology nurse has remained constant, and that is the relationships that are built between patients and their families. If you notice, I keep saying their patients, or my patients, and that was done deliberately, because oncology nurses take ownership of those who have been entrusted to our care. We take ownership of them. We watch over them kind of with a motherly or a parental concern. We hug them. We encourage them. We teach them. We instruct. We scold. We defend. We worry about them. We celebrate their victories. We mourn their defeats. I personally, and I can talk after 30 years, I can talk. I have buttoned coats, I've wiped noses, I've changed diapers, I have purchased medications for patients. I've given money. I have offered comfort when they've had a bad day. Again, all these parental types of things that we tend to do over in our lives. But the single most important role to me as an oncology nurse, whether it's me having been a nurse for 30 years or the novice nurse who's just out of school, is that I have to be a dispenser of hope. There's a proverb that says hope deferred makes the heart bitter. And whether I encounter a newly diagnosed patient who's sitting there overwhelmed at the diagnosis, or a person in another stage of their illness, I must never shatter the hope of these patients. And we must, as oncology nurses, we must take ownership of the fact that we become custodians of our patient's cancer experience. And as such, we must govern ourselves accordingly. That is, to me, is the biggest role and the most important role of the oncology nurse. And that concludes my presentation. Are there any questions, concerns, or comments? Yes, ma'am.
You have
Yes.
a wonderful sense of humor. How do you encourage the other staff to, brighten up what could be, a down day for people? Like, it's just natural with you. You worked at it probably long before those 30 years you talked about, but it's very infectious, and I'm just wondering how you do it, because some other people are always, some other staff are just not in that role.
Her question was, I have been watching you from back there, so I knew what to do. He was back there giving hand signals, and I was watching him while I was sitting over there. Her question was how I use humor in whatever I'm doing, and I guess she picked that up from a few things I said, and she said, how would I convey that to some other staff members that may be less inclined to use laughter or to find humor in certain situations? And what I've learned is that laughter heals on so many levels. And I don't want to encounter a patient and they have a certain diagnosis looming and they come in and I'm sour or that to me is not dispensing hope. That to me, my demeanor can make or break a patient's experience on a certain day. And one day in a patient's experience can really impact them for weeks to come. So it's important to me whether I'm got this new patient over here or this person in another leg of the journey to be light as I can, because I don't want them to think that I know something about their diagnosis that they don't. And a lot of times when you're that serious, that's what is conveyed. So normally what I have done in the past, especially when I've managed, I've had a very lighthearted unit. We do a lot of laughing, we joke, we do things to build the team, because if we do that and feed that within ourselves, then we have it to give out to those entrusted into our care. We cannot walk around when we've got people's experience and we are the custodians of your cancer experience. So I got to take care of that. And part of that is making sure that you understand that I'm here for you, that I love you, but that I'm willing to share joy with you, because this is not the end. If you go in every room thinking, oh my God, I got a cancer patient in there, that is not going to convey well to anyone. So for me, laughter has always been a part of my life. You're correct. Long before nursing school, my grandmother was very, very funny. And I took a lot of that from her. And I just learned that it goes so far in taking care of people and in experiencing people and encountering people. Laughter can break down all kinds of barriers. It really can break down all kinds of barriers. It can dispel fear, and it can show love. And if that's not what we're doing, no matter what we're doing, then we are all failures. You're welcome. Thank you. I didn't hear you. That is a very good question. There was a time when I was working inpatient, and we had a 19-bed oncology unit, and we took care of a lot of patients, but we had a leukemia patients. And they would come to that 19-bed unit, and we would induce their chemotherapy. They get induction and then consolidation, meaning after induction, their bone marrow is wiped out. So sometimes for 6 weeks, they have no immune system. And our care of them dictated whether they made it to the ICU or not. And so I had a patient, he was so sick. His wife was there, and I was taking care of him every time I was there. He was almost a one-on-one. That's how sick he was. And one night we finally got his fever to break because he had a fever. And I was walking to my car after I got off, and I was like, I don't know if I can do this. God, I need to find, and I did talk to God, I need to find a different area to work in. And I heard his voice as clear as day say, no, ma'am, I have you here. This is where I want you. And I said, well, I'm just so tired. And I learned from that fatigue can be on all levels. You can be spiritually fatigued, mentally fatigued, emotionally fatigued. If you're all of those at once, enough sleep is not what you need. But God told me, when you feel empty and tired like you are now, come to me and I will fill you again with what you need to give out. So my spiritual life is what has kept me from getting burned out. And then I know when to take days off. I know when I need to refuel, so to speak, because it's very important to me, again, that I not dash hope by coming in, dragging and, snapping and doing things that just I should not be doing when I have people's lives literally in my hands. Amen. I got one amen. Any more questions? Anybody?
We still have a couple minutes, actually, because our next speaker is just couple minutes
Well,
behind.
I shortened it so that I would have time for question and answer, because I didn't want the man back there doing me like this. I told y'all I've been watching him all day. He's been back there giving signals. That's why I knew to repeat that question. I'm telling you. Any more questions, comments, concerns? Yes. Yes, sir. Yes, there are plenty. His question was, are there any male oncology nurses? And when I was younger and working in oncology, there were 2 on our floor, that floor I was talking about, that 19-bed unit. And they were some of the best nurses that I had encountered. Well, now, and especially in the States, the male nurse population has exploded. There are male nurses now that, and I see it, and I'm glad to see it, because we get so into stereotypical roles. Nurse is a woman's job. But now there are way more males in there. And I have to tell a quick story if I can. I had a patient who one of the male nurses was named Frank, and he worked the afternoon shift. He came in at 3. And every day at 2:30, she would call me. I said, may I help you? And this is how she talked. She said, yeah, Cam, can you come into my room? I said, yes, ma'am, I'll be there. Every day, she wanted me to get her wig out of the closet, help her put it on, and get her lipstick out because Frank was coming. She knew that he would care for her from 3 till 11. And so it was important. Now, she didn't care how she looked for me. But at 2:30, before Frank came on every day, I went in that room and I helped that lady get herself presentable for Frank. So to answer your question, the male nurses, period, is just really booming in the States. There are more than ever, and I'm very glad to see that we are not so pigeonholed into thinking that only person that can care for somebody is a woman. And I figured that started early on because they figure women wipe butts better than men. And that was a lot of what we had to do before. I'm just saying. Absolutely not. But I figured that may be how some of you all feel at this time of the day. After being in the conference for 2 days and I'm finishing up, I'm figuring that some of y'all may feel that you can soar like that. Plus, if you look at that, it's such a hopeful picture. It has the sun there, has the ocean, you got the birds, and she's flying along with them. I have never been that graceful, even though I was an athlete, but I've never been able to have my legs at that kind of angle, ever. Anybody else have any questions or concerns, comments?
Hello, it's me, right here.
Hi.
I just have a comment.
Yes, sir.
My experience is being the caregiver for my wife's cancer. 4 years ago, this summer, she was in the hospital for a month and then went through the transplant procedure at the Royal Jubilee in Victoria and then at VGH in Vancouver. My experience was that the nurses were everything. I mean, there were some great doctors, practitioners in every area, but the nurses were what connected everything.
Yes.
So I totally support everything that you're saying. I think nurses are wonderful. I had never experienced that. That started with ICU. The ICU nurses were just mind-blowing. I don't know how they do what they do. And the oncology nurses and all the practitioners throughout the hospital were great. So I just wanted to throw that out there.
Wonderful. Did everybody hear him, or do you need me? I can repeat that easily. And I didn't pay him a thing, guys. I did not pay him to say that. I want you to know. Did not.
And I would like to follow up on that because I concur. I've been living with this for 16 years and I've had amazing docs, but the nurses are always there for you. I can, phone them, they phone me back right away, they organize my schedule, so without nurses I wouldn't have had such a smooth journey. And I want to remind you, it's International Nurses Week, and please, as Martine mentioned earlier, we do every year present an award to a myeloma nurse in honor of Marion State, who was a nurse, a myeloma patient, who created the first support group in Canada, and upon whose foundation, whose legacy, we built Myeloma Canada. So we do it to honor Marion, and please send us your nominations for the Myeloma Nurse of the Year.
Great. And my name is spelled K-I-M. But thank you all so much for your time and your attention, and I'm glad to hear that you had that wonderful experience, because that is exactly, in my opinion, what the nurse should be, how they should be, and my heart just is overjoyed, not only with that, but how great you look and how well you're doing after that. So let's give everybody that's surviving in here a hand.